On this episode of the Jiu-Jitsu Therapist Podcast, I'm joined by Dr. Moriarty. Dr. Moriarty is a Jiu-Jitsu Black Belt. Some of his accomplishments in Jiu-Jitsu include being the Pan American Champion and Brown Belt, as well as a Brown Belt World Champion. We discuss kind of his path in Jiu-Jitsu and also how he started his path towards becoming a physician, and now his residency as a physical medicine rehab doctor. We get into everything from injury prevention and kind of talking about his ideas on injuries and training regimen, things that he's done and how he's competed at a high level, and also how he has continued to train, while getting busier and busier and kind of making sure that he keeps his jiu-jitsu sharp. I hope you guys enjoy the podcast. Dr. Moriarty was an awesome resource, and he's got a ton of great information, medical information we talk about that may be beneficial to some of you guys to really learn about injury prevention and staying safe on the mats. I hope you guys enjoy the podcast, and here we go.
You are now listening to the Jiu-Jitsu Therapist Podcast.
Well, how are you doing, man?
Good. How you doing?
Thank you for coming on. I appreciate it.
Sure. My head cut off.
Right. What's that? I'm sorry?
My head was getting cut off.
Yeah, that's a good point. They called you Big Head, didn't they? Somebody did.
How'd you hear about that?
I saw it somewhere. What is it? Something with cabeza. What do they call it? What's it?
Cabezón. Yeah.
Do you really have a big head, or are they just making fun of you?
No, I used to, you can see when my hair gets long, but when I was younger, I had no style at all. My hair would just get huge.
I got it.
And I would come first thing in the morning, my hair would be like, so Jacare, there was 5, guys named Cabezón at any one time, you know what I mean?
Really?
That's his favorite nickname.
So you weren't special in that
No,
aspect?
Really not. There's another DJ Cabezón, then there was a Brazilian Cabezón, and they'd be like, yeah, there's shithead Cabezón. There's another,
Shit, so. Nice. So, where are you located out of? Where you live?
I'm in Miami now.
Miami. You're studying?
Yeah.
You still studying for? I guess, are you in residency right now for med school?
Yeah. So I took off my badges. I'm a PM&R resident. So I'm a third year PM&R resident. So I finished medical school in 2014. I did my internship, and then I kind of had a gap year, and then I'm in my second year of PM&R training. It's 3 years after internship, so 4 years after medical school.
Okay, so for people that don't know what PM&R is, can you describe a little bit kind of what that specialty is? Or what it stands for? So
PM&R stands for Physical Medicine and Rehabilitation, and it's basically, I would say the easiest way to think about it is that you break it down into 2 components. So there's an inpatient component and there's an outpatient component, and they can be very different. So on the inpatient side, we run what are called acute inpatient rehab facilities. And so those are different from what most people think of as rehab facilities, because there's different levels of rehab, right? Depending upon how severe you are, how much you need, how long we think you're going to be able to get to a level where you can be independent, depending upon how much help you have at home. So there's acute inpatient rehab, and then there's subacute inpatient rehab, which most people think of. They're usually part of a nursing. They're usually within a nursing home, but they're kind of separate. And then there's long-term acute care. And so we run acute inpatient rehab centers. So people that have more complex medical needs, that they're kind of stable. They don't need to be in a pure hospital setting, but they're not ready. They need 24-hour nursing care and a physician seeing them every day. And usually they kind of have certain diagnoses that we specialize in. So traumatic brain injury would be one. Or we deal with a lot of complex stroke patients or patients that have had spinal cord injuries, and then patients that have had really severe burns or multi-trauma with fractures, and then they end up with, contracture joints that they can't move, or spasticity, or, wounds. So we manage, take care of people, help them get back to, a better level of functioning, try to get them as close to what they were doing as possible. And we teach people if we're not able to do that completely, how to modify their lifestyle. So we give them tools. So we might give them, a foot ankle orthosis. When they walk, if they can't dorsiflex their ankle, we might fit them with a foot ankle orthosis, or if somebody has an amputation, we'll teach them how to walk with it and things like that.
So you work pretty closely, with OTs or occupational therapists and physical therapists.
Yeah, so every day, PT, OT, speech, rec therapy. We work in rehab psychology is really important, especially with people that have, things that new spinal cord injuries or traumatic brain injuries, working with the families, because the personality can totally change. So that's the inpatient side. On the outpatient side, you have the people that specialize in those fields. They might have their outpatient clinics where they follow up on those patients. But then there's a kind of a whole separate side of PM&R, which focuses on musculoskeletal conditions, so sports medicine or pain management. So we do a lot of, because of our training in dealing with rehab in general, we kind of assess people when they come into the hospital for, we do a full strength and neurological assessment to kind of determine, we look, where they are, what we think they're going to be capable of, what kind of modification we have to make. So that kind of helps us in the outpatient musculoskeletal realm. It makes us a good fit for sports medicine. And then because of that, we practice a lot of injections, knee injections, shoulder injections. And then we also learn a lot of fluoroscopically guided injections that we'll do for pain management. So radiofrequency ablations, epidural steroids. Mm-hmm. And then we do a lot of, on the outpatient side, we also do electrodiagnostic testing. Okay. So people that have, burning or numbness in their hand, we can attach electrodes to you and stick needles in your muscles and kind of determine where those symptoms might be coming from. So it's kind of two separate worlds.
Gotcha. But I'm a physical therapist, so I've worked pretty closely with some PM&R docs, more on the workman's comp side. But I was going to I want to kind of piggyback. I want to get a little bit on your background, but I want to kind of talk a little bit about, so where do you see yourself as far as going into, what type of practice do you see yourself going into? Being a BJJ Black belt and kind of stuff that you've been through, and we can kind of get into that later. But where do you see yourself, since you're on this path already of, being a doctor? Where do you want to go?
There's a lot of things I'm really interested in. One of the things that's my main interest is, at the risk of making Stuart McGill angry at me, would be saying non-specific low back pain, because Stuart McGill, if you know who he is the man in low back pain research. He doesn't believe, and I also don't believe there's anything such thing as non-specific low back pain. So that's a really strong interest of mine, developing better clinical exams, better recommendations, more specific recommendations, and kind of making people more aware of things that, the tendency for anybody that, has any sort of axial pain to recommend pool therapy, or to say that somebody's low back pain, or try yoga. And there's certain people that might be good for, and there's certain people that you shouldn't recommend that for. And, but that requires a little bit more knowledge than is currently available to most physicians out there. So that's an interest of mine. Jiu-Jitsu injuries, creating a sports medicine niche, or a niche in sports medicine for grappling sports, because, I'm sure I've gone, anybody that's in jiu-jitsu has gone to a doctor and said, hey, and they're, you're 20, let's say you're 20 something, you go in with low back pain. They're like, why are you drug seeking in my office? You know what I'm saying? They're like, what are you talking about? You do karate and you have low back pain. You know what I mean? So creating that niche is really important to me. So, I still want to do research. I'd like to at least be able to devote part of my time to doing research. So maybe that means I work in an academic setting. I'm not exactly sure. I want to keep training. I think I'm going to try to do either a research fellowship or sports medicine fellowship after I'm done. And, we'll have to see. But those are the places that I'd like to be able to focus my energy. How to do that, I'll have to pick up I'll have to figure out as I keep going.
What about one thing that obviously as as a physical therapist, we do a lot of, you're looking at clinical prediction rules, susceptibility to injury. You're looking at, for example, like the modified Oswestry, which is like a low back questionnaire, those type of things. Right. Do you think there's something, and I've always been interested, is there something that maybe you could develop, or I'd love to develop, just like some kind of questionnaire that, shows function in a physical, in a, I guess, jiu-jitsu aspect, or
be like a more applicable functional movement screen.
Yeah, maybe. I mean, I do the functional movement screen, and it's good to an extent, but it's kind of generic, so to speak.
Yeah, and it doesn't. And there's really interesting. There was like a debate that was done at Stanford. It was like Craig Liebenson, Stuart McGill, and Gray Cook, and they were kind of debating that. And there was points and counterpoints, right, to how applicable it really was, and what, and McGill's whole premise is that, like, and of course, like, the more generalizable you try to make something, the easier that tool is to use for people, but then the less useful it tends to be at an individual level, and he's saying that's why. So one of the things that he would say is, like, a lot of these, if you look at a test's usefulness as its ability to be have high inter-rater reliability, you have to make sure that all the people that you're using, right, have really good expertise. Right. You know what I'm saying? Because it's going to be the more sophisticated test, the more subtle the results. And so, yeah, I think that would be awesome. I think that right now there's so little data in general that we just need to get a better idea on a large scale of who really, I mean, we all have ideas about what kind of person gets injuries and what they're from, but what is it? What's the truth? You know what I mean? Like, what does it actually show? Like, a lot of people will say, heel hooks are too dangerous, you should only be doing them at this level, or this move is too dangerous, or, people, we don't do a lot of academies don't spend a lot of time starting on the feet, doing something. And because people have anxiety about falling, and then a lot of instructors don't have confidence in teaching it, and so they feel like it's too dangerous. And, but then you see people that have been 50 to 60 years old doing judo and taking falls. And right. So what is the truth right now? I think, like, I'd like to see that too, to be able to make prediction rules. And actually, interestingly, not really prediction rules, but a study just came out, like, on the 23rd of this month it was looking at risk factors. It was stratifying people by age, and then it was kind of looking at the relationship between certain demographic factors and clinical tests and age and belt level. It was correlating all these things, and they were saying, I think it was for adolescents, female gender, and I can't remember. It was female gender was the strongest. That was the thing that had the highest risk for being injured, but only for adolescents, which was like 12. It was 12 to 17, or it was 12 to 17, but they really only had 12 to 15-year-olds. And then for masters, it was global posterior chain, lack of global posterior chain flexibility. So they had people stand on like an incline board and bend forward, and they measured all these points.
Gotcha.
That didn't apply to adults or adolescents. So, like, right now, I guess I'm kind of going a roundabout way, but right now I think we need to get a whole bunch more data first, and then down the line, yeah, that would be great.
Well, I think what you described, you said in my training, adolescent females, 12 to 15, there's a lot of, if you look at, there's a high prevalence of ACL injuries, in soccer players at that age. And a lot of times it's because, or even college age, and a lot of times it's because they have some muscle imbalances, or like, maybe growth factors that there's, the tendons aren't strong enough, whatever that may be. And then when, so I think it just depends. It's variable on, then we're talking about master's age, so 30 plus, so we're looking at, there's, I think, a lot of physiological factors. And I think you can't, I don't know, it's kind of hard to relate, I think, a certain injury to just jiu-jitsu per se.
Yeah, you absolutely can't. I mean, the only thing that you could do would be, at some level, like, you have an overall incidence rate if you use incidence rate, right? Like, for our study, we were going to have another meeting with my co-author and then my faculty member that's, she's done so much research and written grants. She's kind of helping me navigate the study, and she's really good with stats, figuring out what's the best way to represent like the total injury. Is it injury rate? Because then you have to have athletic exposures, and the way our study is designed, that makes it a little bit hard. But I think like to compare those across sports can be useful, and then you can say like in general these are the most common injuries, and then you can compare jiu-jitsu to judo to wrestling. But then when you, of course, like that doesn't mean anything to the average jiu-jitsu practitioner. You're kind of interested in like what your risk is, and that depends on your belt level, your age, your prior injury history, what kind of jiu-jitsu style you have. And so there was another article that was written in like 2014, and it looked at people that said that they were passers versus guard players.
Right.
It looked at them. It kind of looked at them in terms of different physiological characteristics. Sure. But the only difference that I think, the only statistically significant difference they found was increased truncal extensor endurance in the passing fight and the people that were passers, which is logical. If you're standing up and bending over, in order to be able to tolerate that position, you have to build up some endurance. So like those things are going to be what's important to you as an athlete. But
are those? Have you seen? I had Dr. Ethan Kreisworth on the podcast. Are you familiar with him?
Oh yeah, I've been, of course.
So I had him on a podcast, and he's done some studies and stuff. So I was talking to him about injury prevalence and rates and stuff. I don't know if that's the study you were.
Oh no, definitely. I definitely read. I've read through that study. Actually, I've communicated with him about that study and told him what I'm doing, and definitely that's the study that we're going to be referencing. There's his study, and this guy, I don't know him personally. This guy Scoggins, he did they were the first two studies looking at injuries occurring as a result of competition. And the only injury studies, and then the one I told you about recently that just got published like a week ago. I definitely know.
So you had it was a questionnaire you put out, I think.
Yeah.
I actually shared it, I think, on my Facebook page. Can you describe or tell people people didn't get a chance to fill it out, what exactly that is and what you're trying to accomplish with it?
Yeah, so I've had this idea ever since, I came to this residency. I knew I wanted to do an epidemiologic study of jiu-jitsu injuries. And I'd seen Dr. Kreisler's study, and then I don't know if it's Mr. or Dr. Scoggins he did a bunch of he looked at like a bunch of tournaments over like almost 10 years in Hawaii. And I wanted to look at, I thought those were great models, but I wanted to look at in general, because most people, I would assume, and this tends to be the case for most sports, I think, more injuries tend to happen in training just because you spend a lot more time there. And then you have this whole subset of people that don't compete, or they only compete once in a while, and they're probably not in quite as good a they might not be in quite as good a shape as somebody that's competing all the time, and especially at a high-level event like the World Championship. So I kind of wanted to look at that. I wanted to look at injuries in general, kind of just to get a better idea of what kind of injuries people get in general in jiu-jitsu. And then, so the first part of the study is really just actually got the idea for the design of the study from a CrossFit injury study. I thought that their design was really easy and logical, and so I kind of that's another study that we're going to reference. I took some of what they did and I adapted it and added jiu-jitsu specific. So the first part is mostly like demographic questions. How old are you? How much do you weigh? How tall are you? How long have you been doing jiu-jitsu? How often do you train? How many times a day? Do you train with the gi more or no gi more? Do you spar? How often do you spar? Do you spar every time that you train, or do you? And I was really surprised by the answer to the question. Of course, like I can't speak specifically about that, about the data exactly, because we haven't gone. We had over 1,500 responses.
Oh, it's awesome.
So I can't, I haven't been able to look through every single one because I've gone through it, and some things that people wrote, I can't figure out what it means, or it's kind of illogical, or it didn't answer the question. So there's going to be some data that's kind of get thrown out. But I was really surprised that a lot of people didn't like, a lot more people than I would have ever thought doing the study did not spar every time they trained. Like,
really?
And it was like 25 to 50% was the largest group. And that was really surprising to me.
So meaning they didn't do like rolling like rounds after training.
They would go to a class and they didn't spar, right? Huh. And it was really strange. I never would have thought, going to all the places I've ever trained, the amount of time I trained, there would be that many people. So it tells you something, when you do a study like this, you think that you have a representative, you have an idea in your head of what your sport is, but maybe you really don't, Yeah. But again, I have to go through the data. So anyway, have those kind of questions. Then I asked a bunch of questions, not a bunch, but a couple questions on skin infections. Okay. Because we don't have, there are just tiny little bits of research on that, like just kind of thrown in a couple of the studies, but very, very, very small sample size. I remember one, they only had an actual diagnosis for the skin condition in 10 people. Oh, really? So we did a couple questions about that, and then we basically said we asked questions about injuries, and basically our threshold for injury. Again, this was adapted from the CrossFit study because I thought this was clean. I thought it was logical. Because all the studies use different parameters or different definitions. But we said you either couldn't train at all for a week, or you had to modify your training for at least 2 weeks, or you went and saw a professional. Okay. So we made it so that it was something that disrupted your training. It wasn't something that just kind of bothered you here today, gone tomorrow. And there was one study that looked at that, defined an injury as anything that stopped you from training for 24 hours. Who knows? So, and then we basically said, we asked basically the same series of questions for 3 different injuries because you just can't analyze data forever. You can keep going. But most people didn't, the vast majority of people didn't have 3 injuries. Okay. So that's kind of what we did. We have a lot of things that we can kind of put together. So the things that I'm kind of interested in looking at, first of all, I think that one thing we haven't looked at all, no studies, is gi versus no gi. Okay. Right? A lot of people, I personally feel less safe. Me personally, I feel less safe when I'm training no gi.
Why is that?
The mat gets wet. And so like, even if, your feet don't necessarily get wet, but the gi soaks up a lot of sweat. So if I move somebody's legs out of the way and I move their torso out of the way and I step on that area, it's not wet. You know what I mean? But if you're going no gi and the guy's sweaty, you step there, you slip, it's easier to yank your arm out of things. It's easier the speed is much faster. There's a lot more scrambling. And then that's even aside from the submission aspect of it. I just think it's a little bit more. It's just faster. It's more aggressive.
Yeah, absolutely. Less friction. Less.
I always make the effort when I'm training to be more aware of where my face is. And if I feel like somebody's gonna, if I'm holding a single leg and somebody's gonna yank their foot out, I move my head out of the way because I've seen people eat it on the chin with a heel. Somebody tries to eat their foot, like boom. And so that's one thing that's really interesting to me. And I want to look at that. I want to look at men and women. I want to look at experience level. My opinion, my theory or hypothesis is that, degenerative injuries are going to be more common. You're going to see people getting they're going to have some disruption in their training as a result of maybe neck injuries, a little bit, right? Because you don't even really learn how to roll across your shoulders and do those kinds of things until until you start to develop a good guard. And then you do that for 5, 10, 15 years. Whereas I think for the newer people, it's going to be more like long joint injuries where people, they don't know when to fall, they put their hand down, or they don't know when to let go of something, they don't know when to tap, So I think it's going to be not so much, maybe there'll be a difference in total injury incidents at different levels, but I think there'll definitely be a different pattern. So those are the kind of the initial questions. I mean, there's a billion that we can ask after that.
What do you want to accomplish with your study? What's the main goal? Like, what's the ultimate, what's the ultimate thing you want to gain from it? How can it help?
I just want to know, I want to be able to, when people talk about these kinds of, when instructors talk about these kinds of things, when they talk about, you got to be really careful in that position, or, man, this is, everybody gets injured doing this. It's like, to be able to actually have this data, there was a YouTube video that Henry Gracie made, and he was talking about like the most common injuries. And I'm like, watching, it was a weird video too, because it didn't even really have that. It was one of those videos that's like advertised as one thing, and then you start watching it and it's something else. And I'm like clicking through it, like, what is going on? But I was thinking, like, how does he even know this? It's just because it's just in your personal experience, and their curriculum is very different. Their style of training is a lot different from other places. So I just want to I feel like there's a lot of things, our sport, it's an amazing sport. Like a lot of us I've dedicated a significant portion of my life to doing it. It's just not as professional as it needs to be. I think that we could, I think that the advent of the purses for fighters and all the new, like the new tournaments where you can actually make money and better sponsorships and things like that have helped a lot, but we're still lagging so far behind in terms of our knowledge of our own sport, just the mechanics of our own sport, and how people just having physicians that actually know anything about our sport. Right. So my main goal is really just to increase awareness. Is to just increase awareness and have really good concrete data that people will be able to piggyback stuff. The way that I was using Dr. Kreisler data, people can use my data, and and just if we get some really good questions answered, or if we generate new questions, then I can go, man, this is something that we need to study. I'm going to do a perspective study on this. I'm going to get like a bunch of people and work on this. Mm-hmm. One study turns into another. So that's really all I want. I mean, this is definitely not the end for me. I love this stuff.
So you're kind of using it as like a springboard, essentially, to get you maybe tailor your study to something a little more specific, or give you a little more details.
Yeah, I mean, like if you had a sport like football, you can't even it sounds silly to say, I'm going to study football injuries. It sounds silly, right? Because you can't do that. You'd have to say, I'm going to study Pee-wee football injuries. I'm going to study knee injuries in Pee-wee football. Right. Because that there have been 10, 20,000 studies on football injuries, And it's so you can talk, somebody can read, you can Google, or you can go down UpToDate.com or any, database and Google any question that you have about injury, specific question. There's going to be somebody that's thought of it and written a study. In jiu-jitsu, like you look up jiu-jitsu injuries, there are 3 studies. Yeah. And then there's one study that looks at low back pain incidents, which is, it was a good study. It was illuminating, but they're very small. Right. Dr. Kreisler's study is by far has the most people that admitted to having an injury by far. Yeah. And it's still, I mean, it's a pretty good number. I think he had like 952. But if you look, I was looking at a jiu-jitsu or judo study the other day that it was just incredibly detailed and well done. And it was looking at very specific questions and had a similar survey. And they had over 5,000 people in that survey. Wow. And they were able to break people's skill level down. It was like international elite, international, national, regional, recreational. And then they're like, okay, so that we don't confuse experts with non-experts, we're just going to throw out the regionals. Wow. Yeah, and then they were able to look at, different injuries across these, experts versus non-experts, and then, man, it was crazy. And then there was just so much data, and we're so far from that. We just need to get started, right?
Yeah, I think looking into injury prevalence. I mean, I was talking to Dr. Kreisworth as well, and we were talking about just rule sets, different rule sets, IBJJF versus NAGA versus EBI or whatever. Just looking at rule sets to figure out what's are certain rules actually, protecting, people, or certain rules are not? He felt like like, for example, Naga allows, I guess, heel hooks for like younger kids or younger belt, I guess, like maybe teens and even white belts, I think, can heel hook. And he said and they also allow reaping. I kind of asked him about reaping, which, I don't know as far as, he says the data explains that reaping does lead to more injuries, more knee injuries, that type of thing. But I don't know. I've talked to another guy in the Indiana area who runs a tournament called the EJO. What's that?
James.
Yeah, James. I talked to James Klingerman. He's like, man, he's like, in all the years, and I've done this tournament numerous times. He said, I've never seen an injury due to reaping. But again,
I can tell you right now, look, I can't, all that any of us really have are anecdotes until we publish something.
Right.
You know what I'm saying? Unfortunately, like, because even if you see a certain number, you can't say anything about that unless you compare it to something else and you're evaluating it statistically, But I remember I was just trying to, like, protect my guard. This was years, it was like 10 years ago. I'm grappling this big guy, and I was like single leg X, and I bring my leg over, and I just turn, and I wasn't even really trying, and his knee exploded.
Wow.
Of course, like, look, I think that the one thing that will hopefully be interesting in this study too, and it's another thing that we're going to try to look at, is we're going to look at the severity of injury. So we asked another question about how long did you have to abstain, and so there's some other studies that I've looked at that were that said, well, some good studies that said if you were out for 6 weeks, that was significant, and that was validated by some other studies. So we're going to have to determine like what significance is, but definitely surgical, right? So surgery is going to be one that's significant, and I definitely think look, people are going to compare injuries like, oh, there's way more finger injuries than there are injuries from heel hooks. Yeah, that's true, but you can tape your fingers together and roll. Yep. You know what I'm saying? Like, heel hooks are really interesting because they're this is just my opinion, but it seems like in jiu-jitsu, the more dangerous that a submission could potentially be, the more skill you usually have to have in applying it. For instance, like a straight ankle lock, it's not that easy to do, right? Like, it took me a long time to figure out how to really do a straight ankle lock well. It requires a lot of finesse and practice. Knee bars are very hard, right? It's much harder to do a knee bar than an arm bar because, right, that's somebody's whole hip. So you have to really land it perfectly, right? So in an arm bar, right, like, it's easier to learn how to rear naked choke someone than actually get someone an arm bar, right? Or an omoplata, or things that can be really dangerous. Heel hook is really interesting because it's actually way easier than any of those things to do. Mm-hmm. Do you know what I'm saying? Like, you put the toes in here and you go, whoom. And if the guy that you're rolling with doesn't know, you can hurt him real bad.
Oh, yeah.
So heel hooks are interesting to me, and they're unique to me, and this is just my opinion, like I said. They're unique to me in that they require the least amount of skill to do the most amount of damage. Do you know what I'm saying?
Sure.
But that doesn't mean I'm not against them at all. Yeah. I think that everybody should be learning them. And I'm not for banning them at all. I mean, I'm not for putting them in with the gi. I'm not. But I'm not for banning them. I think they should be legal in IBJJF tournaments at brown and black belt. Mm-hmm. I do. But I think it's kind of silly to say that, when people make the argument that, heel hooks aren't dangerous. I mean, of course they're dangerous.
Sure. I mean, everything's dangerous, I think. Like you said, somebody gets heel hooked or inverted heel hook or something like that. I mean, you can blow out their knee, and there's ACL and all that, and that's a major. That could be a career ending, or
And it's like, because what is the people refer to? Oh, I'm going to show you the braking mechanics. So the brake is on the ACL.
Yeah.
It's on a ligament. You're intentionally putting tension across the knee in such a way that if the guy doesn't tap, you're putting him out for 6 months to a year.
Absolutely.
Right? You know what I'm saying? So it's not like somebody can hyperextend their arm. You see it all the time, and they may. It depends upon how severe the injury is, but they might be back in a month or two.
Yeah.
You know what I mean? the only thing that I can compare it to that's really that dangerous is like a knee bar. But like I said, it's not that easy. You know what I mean? You could try to teach them how to do a knee bar. They're not going to get it, you know?
The other aspect of you know, I did like a YouTube video on it, but the other aspect I feel like as far as like a heel hook or inverted is usually, in my opinion, it's not terribly painful until the damage is done.
It's late, right.
So it's like you can kind of sit there and eat a heel hook, and then like all of a sudden when once that pop happens, that's when all hell breaks loose, you know. But you know, I mean, like some submissions are like you can feel them getting, you know, painful and like you tap, you know.
You feel out of control in most other submissions. So like somebody's arm barring you, right? Like they have their leg over your face. You can't really breathe. You feel dominated. Yeah. You know what I'm saying? And so, you know, people scramble that all the time too. But with a heel hook, if you don't really know it, you don't feel like it doesn't feel like much until it's too late.
Exactly.
You know, so I think we kind of have to come together. Like there's the people that's like, they're too dangerous, and then there's other people that they just want to use them and they're frustrated. So like they're not dangerous at all. And it's like you're both wrong. They are dangerous, but I mean, of course, like just because a move is dangerous doesn't mean that you don't try. You have to learn. Like I say to everyone, it's not my style to use heel hooks. I mean, I like them. I love playing with everything. It's just not like my style because I train more with the gi. Mm-hmm. But man, I learned a lot. Like I'll take time and learn everything. And I think you should be able to, especially as a brown and black belt, and the black belt's been doing jiu-jitsu a long time, you should be able to defend yourself. You know what I mean? Or at least know where the danger positions are. And if you can't get out, know when to tap. You know, it's important. So I think, but we need to come to a more realistic understanding. But, you know, who knows what the research will show. That's going to be, it'll be interesting.
Yeah, the other thing with the research, you know, and I was talking, like I said, Dr. Christworth's study, he was talking about a lot of people didn't realize they were injured until the next day, or like their adrenaline was pumping so bad, or they didn't, you know, say they were injured. They just kind of didn't mention it, or, you know. So I think there's always injuries slip through the cracks.
That's a tough thing too about the way that the other studies were designed, the way that the two studies were designed, they were mat side.
Yeah.
Saying so you really had to catch it. You had to catch it then. You know what I mean? But fortunately, there's pluses and minuses each way. But fortunately, one of the things about our study is that we're going to catch those because we give people basically like a 6-month window. We say within the last 6 months.
Yeah.
And we did it that way on purpose because it was kind of, we didn't want to say, so we asked you, like, how long have you been doing jiu-jitsu, right? And then if we said any injury that you've had, any 3 injuries, right, then how accurate are you going to be in telling, you're like, well, I think I had this injury like 10 years ago and I had this one too. And then it's going to be so confusing because now we're going to have to separate when you had the injury and then put it in this level of experience versus. So basically everybody that's reporting injuries are reporting it at their current level of experience. Wow. You understand what I'm saying?
Yeah, yes.
So, I definitely think that's a problem. Because, I mean, of course, like, I popped my ankle at ADCC in 2007. I remember rolling over it, like, and it goes, and I just stepped on it wrong, and I twisted it, and it went boom. But I didn't tell anybody because I didn't want anybody to see, that I was injured.
Right.
So I didn't say anything. I just told my coach, I walked over and I told Shakare, I was like, man, my ankles, And he's like, no, it's okay, it's okay. So I just kept running because I didn't want my ankle to swell up.
Right.
So I had tape on, so I just kept running to just, because I didn't want it to get stiff. So I kept running and running. I ran for like 20 minutes until my next match. Exhausted myself. But yeah, of course, people, especially at high level, you're not going to tell anybody anything.
Right. So what do you like as far as, talking about injuries and injury prevention, like what do you feel? You had mentioned about part of your work or part of your PM&R, like injections and things like that. Those are part of the the things that you do. What type of injections have you seen, or do you feel like are effective for injuries? For some people, and also I kind of want to ask you about any research that you've seen. And there's a lot of stuff going on about stem cells and those type of things. So I want to kind of ask you about those. I know it's a ton of shit to get through. So let's just start with what do you do, like as far as injection wise, what do you feel like is beneficial to injury prevention or to get over injuries?
So most of the injections that when you talk about like therapeutic injections, unless you're talking about axial injections like in the spine, most of what you're talking about, like 95% are going to be knee and shoulder. For the average young person with an injury, I don't think there's going to be much role for you. The thing about if you do a steroid injection in the knee, right, you're going to feel better. Right. And you're going to go, for people that are young and persistent, you want them to feel pain. You know what I mean?
Sure.
You want them to know what their limit is. You know what I mean? And, of course, like you want them to get better but you want them to do it in a fashion where they're learning something. I mean, if I take a 25-year-old kid, especially a kid that doesn't have insurance, and he develops a medial meniscus tear, and then he's like, oh my God, man, he's killing me, and you inject him, sure, he's going to feel a lot better, and he's going to feel like he can just go back and train, and then 3 months later, he's going to come into, my God, man, he's killing me, give me another injection, and it goes on and on and on. So, like, for corticosteroids, the only place that in my experience, and I'm a third-year resident, so I'm not like an expert on this by any means, but I had a kid that had osteolysis of the distal clavicle, and that's basically, for people who are watching this, it's basically where it's an inflammatory arthropathy, so inflammation of the bones that make up the AC joint.
Right. And
what ends up happening is that there's so much irritation there that part of the clavicle itself starts to kind of resorb and die off. And it's just very, very painful. And there's, unfortunately, the joint itself is stable. So it's people that do repetitive overhead activities. So, for instance, this guy's like an airplane mechanic, but he also does jiu-jitsu and works out. So he never gives his shoulders a break. So someone like him, doing a therapeutic injection into the AC joint, it's for me, there's no other structures in there that I'm damaging.
Right.
You know what I'm saying? I feel like if I can help him, deal with his pain and then put him on, unfortunately, there's not much good data on rehabbing distal clavicle osteolysis, unfortunately, you know what I mean? But, if we can get him some relief and then get him to do some exercises, some lighter work, and then I was talking to him about, man, if there's any way that you can adjust so that you can raise yourself up higher and work more in the frontal plane and less over here, then it makes sense to me. I think but for the majority of people, and maybe like I've seen, a tendinopathy, so bicipital tendinopathies, sometimes those are just nagging and they don't go away. I've seen that that can be helpful sometimes. As far as like stem cells and like visco supplementation is a different thing. As far as stem cells, I'm not the best person to ask about that. There's a lot. It's a big thing in rehab right now. Everybody's teaching you. And like, for instance, platelet-rich plasma. Yeah. So there's all these companies that will teach you how to, spin down sample blood and make your own plasma and be able to use it as injectate and, come up with protocols and stuff. The evidence isn't great.
Right.
Evidence isn't great. I think with PRP, like I said, I'm not an expert at this at all. I think the PRP, the best applications that I've seen, I could be wrong, were like post-surgical, like let's say that you reattach the supraspinatus tendon or you reattach the tendon, and then as part of the healing process, you do an injection of platelet-rich plasma. I think that seems to be where more the benefit is. But in terms of like chronic injuries, I'm not sure we're there. Yeah. Tendinopathy is really interesting though. So where you take like a degenerative tendon and you kind of irritate it,
almost like poke holes in it a little bit,
almost like make it bleed. You know what I mean? That seems to be that might be something that could come into being useful in the next few years.
Yeah, and I think what the theory of it is, you're bringing blood flow to the area, promote
Right.
healing and that type of thing. I have seen that they do the PRP, the platelet-rich plasma, a lot of times for like Tommy John's or ulnar collateral ligament to help healing. A lot of baseball players or throwing sports, they'll have some issues. Maybe I think it helps the healing. But yeah, the corticosteroid injections, from what I've seen, again with a young person, should be able to recover. From that. But if you're looking at maybe an older individual, that's
definitely
like a chronic tendonitis, that's really
definitely. That's where look. I'm just assuming that most of the people that'll listen to this podcast I don't know if we watched or whatever, but are going to be younger, more tech savvy,
right.
jiu-jitsu nerds like me that are you're looking for everything,
right?
Like anything you can come across jiu-jitsu, and so like those are the kind of people that they don't want to come off the mat ever, and if they, you know what I'm saying, and so, but of course, like the vast majority of people. You want to use it for people where they have a condition that it's not going to get better.
Yeah.
I'm saying they have a chronic arthritis and it just hurts. And there's nothing that, physical that you can help them learn how to better recruit muscles, and you get neuromuscular inhibition from pain, so you help build the strength around that joint. But you really just need to give them something local to help that process, but you're anticipating the process is going to get worse. Or somebody has, like, for instance, like adhesive capsulitis and they can't move their shoulder, and you can't send someone like that to physical therapy because they're not going to tolerate anything. So boom, you give them an injection, wait a week or two, and then you send them to physical therapy. So it's definitely there are definitely uses for it. It scares me to think about using it, except for very limited situations and in athletes, active athletes.
Right. So
as far as what you were saying about PRP, I'll say it definitely. That I think now that you're saying that, I think you could be right about that. And the thing about PRP right now is it seems like it's almost joint specific. Like you'll see one study that'll show efficacy in this type of ligament sprain, but then in this type it doesn't work, and then you have to tear the studies apart, figuring out what the protocol was, and it's just it's all over the place right now.
Yeah. What do you like as far as kind of talking back as far as jiu-jitsu wise? What do you like? What do you think is a good amount of training? I mean, for people, what do you think? Is there? I know it kind of varies among people want to train every day, but do you feel like as far as when somebody has an injury, like do you recommend them taking time off? Do you recommend them doing, say, a shoulder, just a general shoulder injury? Do you recommend them going back and just drilling? Do you recommend them taking some time off? Like, what do you think is? I know it's kind of a broad question.
I'll say, okay, so you have to take the person. It's unfortunate I can't give except for a very, very limited number of injuries, right? You can give like a general recommendation. For me, it depends on the person. Right, like it depends on how aware the person is of what they're doing when they roll. We've all rolled with people that are like robots, and you can like put your hand in front of their face like this, and they don't see you. You know what I'm saying? They're like on like in those kind of people that they have this game and they go, and those kind of people, it's hard to say, hey, when you roll, you can roll, but just do this, don't do this. They're not going to be able to do that.
Right.
Do you know what I'm saying? They're not aware enough when they're training to be able to modify those things. So for those people, if I see they have a certain kind of injury, I'm more inclined to say to them, you need to stay the hell out. You know what I'm saying? But for someone that is that's very thoughtful, even if they normally train really, really hard, they came in, you can do this and this, but this position right now is off limits. You know what I mean? Like if, somebody's you have to accept the sweep in this position. Mm-hmm. And you have to know that person understands what you're saying and that they have the discipline to do it.
Right.
So I think that a lot more jiu-jitsu, it's such every position is so different. It requires totally different requirements in terms of your body, your strength, endurance, flexibility, that you can create a way to do it with a lot of injuries that you couldn't in other sports,
right.
But it depends on the person's ability to be able to abide by those rules.
Mm-hmm.
I have certain things that I think, like little things that I say that I think are really important to prevent injury in general. One of them for me is if somebody grabs your leg in half guard, like you're on top and they have, like, let's say they have your leg in half guard below the knee, you have to be very aware that in that situation, when they rock their hips back and forward, your knee is going to move.
Right.
You know what I'm saying? And if you try to stay planted on that foot, your knee is your knee's still going to move. You know what I'm saying?
Yeah. So you're talking about like the ankle, the bottom of the leg's going to be moving. And like,
so like, say like I have, like I'm, like you're standing up and I jump to make half guard on your leg.
Uh-huh.
Right. And I'm holding below your ankle. Right. So when I rock my hips back and forth, your knee is kind of floating in space, but your ankle's pinned to the ground.
Exactly. Yes.
So it's different if my legs are above your knee, because then when I move, your ankle and knee move together.
Yeah.
Do you know what I'm saying?
Right.
So I remember I was rolling with one guy, and his huge legs, and when he grabbed my leg, it was like a vice. And I immediately felt this thing like, I have to take my weight off this leg, because I don't care where I end up. I have to take my weight off this leg, because if I put my weight here and he moves his hips, my knee's going to explode. Mm-hmm. You know what I mean? So I think that that's why, like, for me, it's very knee cut passing. Man, that's a crazy position if you think about it. I mean, you're basically recreating MacMurray's, in that position by turning the ankle out and, and putting valgus stress on your knee. It's crazy. And so, like, man, that's another position I won't push. If my ankle gets caught behind me, I'm light on that leg.
Right.
You know what I mean? So those are the little adaptations I've made.
Chris, for people that don't understand, that MacMurray's test is kind of it's a meniscus. It's kind of a provocation test for a meniscus injury. You basically are compressing kind of from the bottom of the foot into the knee. You're putting some torque on the knee to see if that, causes any issues on the joint space or in the joint space, I guess. So that's similar. You're kind of reproducing that, and that's a way that the meniscus is injured. A lot of times, a twisting injury or like with the foot planted, so to speak, and then you're turning your knee out in the other direction, right? And you can't control where your foot's pointed. Yeah.
And then there's so many things, if you're an open guard player and then you're trying to bring your legs back inside, and at the same time you bring your leg back inside, the guy goes like this, right? That's ACL sprain,
Yeah. So that's, I think, what I've talked about as far as we've talked about back injuries and stuff and back pain. I think that's where hip mobility is so crucial, because it's like, hip mobility is so important to for back pain, also important for knee health and knee pain, because, that knee is a hinge joint and it's not supposed to go in and out. It's supposed to go forward and back. So if you are not able to position your hip in a proper, if your hip can't get in a certain position, then that torque goes to the knee and the stress gets on the knee, and vice versa. There's so much going on in the back that, a lot of those muscles in the hip obviously attached to, the muscles kind of in the back, they all kind of work together. And that's where I think a lot of that back problems people have is because of, glutes that are weak possibly and hip immobility.
Yeah, there's so many things. So there's for prevention of injuries, there's two components, right? There's we first have to identify what things people are doing in training that you can, for instance, knowing that if your ankle's trapped, if you try to put your weight on it, that's a high risk for injury. But you can mitigate your risk if, maybe not in that situation, but maybe in the knee cut, if you have more hip, if you're able to internally rotate your hip a little bit more, you have a little bit more range of motion that way.
Right.
You can take a little bit of the tension off of your knee. So there's the which things do we need to stress? For instance, is it necessarily good to be super flexible in every joint in jiu-jitsu? Or is it more important to have really good hip mobility? You know what I'm saying?
Yeah.
Instead of saying in general, like you need to focus on these joints. And so there's that part of it. There's what we need to learn to be able to teach people about what is protective in terms of therapy and accessory activity. And then there's the things that we need to be able to tell people that are intrinsically dangerous to jiu-jitsu, that regardless of how well how well oiled you are as a machine or whatever, because this is the last thing I'll say about this, but back pain is really interesting to me. And like I said, I actually had Stuart McGill do a teleconference, or it was a video conference with my residency, because I read all of his books and watched all this stuff, and he really changed my perception of all this stuff. That for instance, that trunk extensor strength is not preventative. It's not. It isn't associated with a decreased risk for low back injury.
Okay.
Trunk endurance is, and those are very different. And flexibility, or for instance, one of the activities that it's not just him. It's this whole group on low back pain that says you shouldn't be doing one thing. Is full lumbar flexion in the morning. Okay. Which is interesting, because if you go to jiu-jitsu class in the morning, one of the first activities that you'll do is full lumbar flexion. And so there's definitely a lot more, but that's where having better hip mobility comes in, because then you have less requirements to do everything to your lumbar spines.
So I know you got kind of want to be done talking, but I am interested in this, and for people as well. How do you measure trunk endurance versus trunk strength? What are the specific tests, or are they just doing like a extension, trunk extension?
The one test that I've seen done that's been validated is, I think it's called Beering-Sorensen.
Okay.
And so McGill and Liebenson and somebody else, they were, I don't know if they were looking at, of course, they developed these tests, and they're like, oh, what are the normals for these things?
Sure.
Because they looked at different tests for, extensor endurance, and then flexor endurance, and then endurance and lateral stability. So they used the side bridge and this thing he called the curl up, and then he uses the Beering-Sorensen. Actually, but the curl up isn't what they use for the tests. But the Beering-Sorensen is basically, it's like you're on a table, and here's your upper body up here, and your lower body's down here, and it's basically you're strapped to a table.
Gotcha. So your lower body's strapped.
You put your hands on the ground, and then when you come up, they start the timer.
Gotcha.
And so they've been able to, and I think
kind of like a Superman position almost, except
right there, you don't
half of your body is not.
Right. You don't have your feet locked in, right? Like you're locked in by straps. So unfortunately, there could be, I'm sure it wouldn't be too far off to modify it with like a Roman chair or something. Mm-hmm. It's pretty similar, but that's kind of how they used it. And then he was able to, there's ratios in, I'd have to get you the reference later for the specific paper, but he does have like a healthy ratio between strength and endurance. I'm not exactly sure how they measured strength. If it was like
maybe reps,
isometric hold, or I'm not exactly sure. So I have to look at it.
I'm just curious, man. I just that's all interesting to me. There's a lot of like we talked about. There's a lot of theories on back pain. Why back pain? What is in the back? Is it a mobility issue?
And you don't think about it. Like we all say things like you need to build up your core strength, but really we all mean the same thing, but we're using the inaccurate terminology because we're really talking about endurance. Because, like, for instance, when does most people, like, if you think about when people's form breaks down, it's when they're tired.
Yeah.
So, like, your muscles get these, like, what I think the theory is that, like, you get some proprioceptive feedback from your muscles to the joints. But then when your muscles start to get fatigued, that signal gets distorted. And so you're not able to make the correct postural corrections that you need to make to keep yourself in a good position. So that's when, somebody will tell you something like, oh, how'd your back pain start? I was picking up a pen. And you're like, well, that's, you know what I mean? But they were fatigued. They've been in a bad position for a long time. And so I think I think we all intuitively understand it. It was just when he said it to me, or when I read it, I was like, wow, that's so logical, you know?
Right. Yeah, and it makes sense. I think there's something, in my opinion, I think it's not always isolated strength component. I think it's a balance. I think it's, hip flexor strength versus hip extensor strength, or, front of the hip versus back of the hip, or,
right.
or abdominals versus,
talking about like Yanda stuff, like cross the cross syndrome.
Yeah, and I think that's super important because the way that I think of it, a lot of times when I educate people, I tell them certain muscles are strong, they're going to overpower some of these looser, weaker muscles. So it's about and this is in kind of simplification. It's like stretching the muscles that are tight and strong, and strengthening the muscles that are loose and weak to an extent.
True, yeah.
I mean the John Doe approach, or is what they call it, I guess. The cross,
lower cross syndrome.
Yeah. So I think that's a great
lower cross. Yeah.
Yeah, upper cross and lower cross, exactly. I kind of, it's a great just general for people that don't have a medical background. I mean, I think it's a great way you see it. You're like, oh, well, this makes sense. This is tighter than that, and kind of balance.
Why everybody has weak glutes and tight hip flexors? Yeah,
right. Because we, obviously sit all day, or we drive, or we study, or whatever. We sit to eat, we sit to watch TV, we sit on the toilet. All these things. Everything is it's like we're not getting the retraining, we're not rebalancing those muscles, which I think is a huge component of injuries. So when you talked about jiu-jitsu wise, if all you do is jiu-jitsu, you are going to get better at jiu-jitsu. And I think the one example that I can think of, the one guy, and you may be able to correct me if I'm wrong, the one guy, in my opinion, in jiu-jitsu that I follow, that I've always looked up to, is Marcelo Garcia. And if you know anything about his regimen, is all he does is he trains. He doesn't do anything else, and he trains 2-3 times a day, and he's an absolute beast, and it's just crazy. But I think he's the exception to the rule, the way his body is.
You remind me, of course. No, I got to spend a lot of time with Marcelo Garcia. I actually went up to his academy 2010, and he helped me train for a tournament. And he's been down. He's just part of Alliance, so he's been down to Atlanta a bunch of times. He's ridiculous. He's amazing, and he's the nicest guy ever. And yeah. I mean,
there's always exceptions.
This is the thing. This is the thing, right, about our sport is we really don't know what works. We don't really have any data for anything, So when you remind me when you're asking me about how often you should train, I can't really say, all I can, because I don't really have any strong foundation to base that on. I would like to see, the sport. Jiu-Jitsu is really interesting because I would like to see the sport have seasons so that athletes can, it almost is like that with the kind of like that with the IBJJF, where at least it used to be before they did all these tournaments in every city.
Right.
Where it was there was the beginning of the year was gi, and then after the World Championships it was kind of like no gi season. But Jiu-Jitsu is interesting from a typical sport perspective because you always have the carrot of the next belt. So it's really hard to get someone at white or blue or purple or brown to be willing to take any time off. And that does two things for you, against you. One is that you will accumulate injuries over time.
Sure. Right?
It's going to catch up to you. And then so you never really give yourself time off. And the second thing is that you can get into this kind of, this is just what happened to me. You get in this kind of game where your game is so intense and small, and you only want to do what you're good at, and then that kind of, when you train like that all the time, it stops being fun and you stop being creative. And so I tell people, unless you have, if you're training for a competition or you're in your competition season, let's say you have a tournament in 2 months. I would say, I'm just making this up, but 6 weeks out, you start saying, okay, I'm not going to let anything happen. I'm only going to do what I'm going to do in the tournament. Because you need to turn that part of your brain on that doesn't accept anything.
Yeah.
That when somebody sweeps you yank your leg out. When somebody tries to avoid your pass, you put more pressure. And you push your cardio, you push your stress. But the rest of the time that you're training, if somebody tries to sweep me, I'll try to avoid it. But if the only way that I can avoid it is by going, rah, I'm going to I'm going to try something else. And then you start, that's how you develop depth in your game. And you see when Marcelo trains, like when he's training with certain guys, he trains really hard. When he's training with other guys, he's letting things happen. He's playing, and that's how you build your mind. And it also keeps you, I think it keeps you healthy mentally. It keeps jiu-jitsu fun, but it also helps keep you healthy physically because you don't get so attached to every position. You don't fight for every single thing. You know what I mean? I think that's a perspective that can be lost because of this whole carrot of the belts, And you see black belts, I think, guys that have been doing it for a long time tend to be smarter. They tend to train like in camps. They're like, I'm preparing for this tournament. I'm going to train hard for this period of time. Then after the tournament, I'm going to be kind of flowing around. Whereas when you're a blue belt, it's tough because you don't know enough to be able to play. You have to just survive. Yeah. So it's hard.
In another interview you'd done, you'd mentioned kind of talking about the seasons. You actually recommended taking time off, like taking a month off, or what do you feel like? Or I'm not saying exactly a month or some time off, extended time off. What do you feel as far as advantages and disadvantages of doing that?
So, I mean, I wouldn't say so. It depends on what you're doing. So I would say that. If you had somebody in an ideal situation, let's say that you had a competition team and you were trying to peak, because most other sports, right, like in wrestling, not every tournament means something to them. Do you know what I'm saying? You go and wrestle a tournament, you're and then you lose, and it's okay, all right, we were working on this at that tournament, it didn't work, and you go to the first tournament, you're not in quite great shape yet, you know what I'm saying? And you're peaking for whatever if you make it to the NCAA regional or the national championships, or you're peaking for that. So I would say if you had a guy and you want to go to the world championship and you're going to have before the world championship, you're going to do 6 tournaments, before the world championship, and so you're training you got to train 3 weeks really hard, and then you kind of take a week and you're a little bit lighter, and then you compete, and then you come back, take a few days light, and then you got to train really hard for 2 weeks, and then it goes on and back and forth and back and forth, and then you finish the world championship. Yeah, what I think it's important to remember that there's other stuff in jiu-jitsu, and there's other stuff than jiu-jitsu. It's important to take that time and get that perspective. I would say if you were that guy, I would say at least the first week, just go do something else. Don't even come to the academy. I don't want to see you here. Just for a week, just go do something else. You know what I mean? Let your body heal, let your mind relax. And then after, you come back the next week, you come on the mat, I'm pairing people up to roll. You roll once, you roll twice, and okay, you're done. You rolled 1 or 2 rounds, you're done. I do that. You do that for a week or 2. I put you with some really light people, because now what I want you to do is I want you to change your brain from being to now I'm rolling with someone that I could just destroy if I'm doing my best game. How do I make this roll interesting for me?
Yeah.
You know what I mean? And just to get people back on that, to change their mentality from to being loose and being open-minded and being creative again. You know what I mean?
I think setting up that environment's important because, I'm a brown belt and I still get in those, sometimes man, I don't want to give this position up to this lower belt or do this or allow this or, so I think it's kind of hard sometimes, but you bring up a great point because it kind of puts you in that mentality and that expectation that your coaches know that this is what you're doing. You're playing right now. So I don't know. I think there's always a thing in the back of people's minds well, I'm this upper belt. I shouldn't.
That's it. I think that's the thing. The jiu-jitsu it's such a primal thing. You know what I mean? Every other sport is a representation of dominance, of physical dominance. You know what I'm saying? But in jiu-jitsu is too. The only real sport is MMA, where that's actually man physically dominating another man, Yeah. But and so of course you have to have ego in order to develop, right? You have to, because you have to want to not lose in order. You know what I'm saying? You have to want to win in order to be able to get to the next position. But you you have to temper that with like not being so desperate to win that you can't learn anything.
Right.
You know what I'm saying? And one of the important things I would say is like one of the things that I'll do sometimes is I will put myself in a situation where we're fighting and then, you know, we're fighting for position and then you start to kind of pass. And if I really, really, really wanted to and I used all my energy, I could get out.
Okay.
But I'm going to kind of let you get there. But then I'm going to try to make sure that you don't know that I let you there. And then when we finish, I don't tell you that I let you there. And I don't tell anybody else I let you there. So that I have to eat it. Mm-hmm. Do you know what I'm saying? And that person goes home thinking that he bested me. Because the more that I can do that, the more it frees up my mind to not worry. You know what I'm saying? It's not the same when afterwards you go, oh, you know, I wanted to let you work. Because then you feel like, he knows that I'm, you know what I'm saying?
Yeah.
And so it's easier though when you get your black belt and you don't, you know, like my degrees are coming. You know what I'm saying? It's not like when you're a purple or brown and, you know, you feel like you want to get your black belt, you know, that's what I'm saying. The belt system kind of takes everything and takes that whole ego component, makes it 50 times bigger, you know?
I always say it puts a bigger target. I mean, I wanted, you know, getting promoted is awesome. It's one of the greatest things. You know, you feel like you accomplished something. And you know, the belts is just a belt. It's colored. You know, my coach says colored piece of, you know, fabric. You know, it doesn't really mean shit. I mean, it's almost like –
but it does, you know.
It does, but in a way, honestly, like the experience and the time you put in and kind of, you know, we've got blue belts at the gym that give brown belts or give myself problems, you know. I mean, they're tough as shit. And but the thing is that, like, I guess the belt is almost it's like a sense of accomplishment or achievement to some extent. But on the other hand, you know, I almost stopped looking forward to belt promotions. Once I got my my purple belt, I was like, you know, I've got a brown belt for about a year, but I was like, you know, I was more than happy to have it, you know, obviously. But sometimes you're just like, man, you almost, I don't know if you don't. For me, I didn't really search it out. Like, I wasn't like, when am I getting promoted? When am I getting promoted? I was just kind of like, if it happens, it happens. If it doesn't, I'm good. You know, I'm still going to keep training the same way and keep getting better. And so, yeah, I think the belt to some people, I think to lower belts, it's like something you chase. But I think when you get up there, it's just, I think once you get to a purple, brown belt, maybe you get to a brown belt level, I think black belt's kind of, it's on the horizon. It's pretty much, you're more likely to get a black belt than not, you know, once you get to a brown belt level. So it's not something you chase anymore. You just kind of want to, I guess for me, I want to make sure I'm ready for it or I deserve it, so to speak. But I don't know if you ever feel like you deserve it. I don't know.
And you'll never, and I know, I mean, I'm not even the same. I mean, I've been a black belt I've been a black belt longer. I've been doing jiu-jitsu longer as a black belt than the total amount of time it took me to get my black belt.
Wow. Okay.
You know what I mean, like,
how long is that?
So 7 years took me to get, and then I've been doing almost 9 years that I've been a black belt, almost.
Okay.
And it's crazy. I mean, my level of understanding, my just the things, the way that you see things is totally different. Like, in terms of like looking for moves versus feeling where something is, you know what I mean? It's just it's so different. Fabio Gurgel told me that years ago. He's like, man, I know, like I learned way more as a black belt than I learned before. That's probably, it could be true. It just doesn't seem like that because you learn like the really obvious big things when you start, you know, and then the further along you go, like the more subtle and nuanced and small that the stuff that you learn seems, you know. So you're never, I mean, it doesn't matter if you're really ready for your black belt because you have the rest of your life to grow into it or whatever.
What do you feel like has changed? Like, is that kind of what your perspective has changed since getting a black belt? I mean, how do you feel like you're, besides all the other factors of being in med school and, family and all that stuff and getting older, what do you feel like as far as your jiu-jitsu how has it changed or evolved since you've gotten a black belt? I mean, do you think differently now, as far as train differently now as you did before?
Well, the thing is that when I got my black belt, it was right before I started grad school. So I did a year of grad school before medical school, and I was studying for the MCAT a lot, and I was already kind of like on that mindset, in that mindset. And so my game changed. I mean, definitely my game changed. It's completely different now. It's crazy how different it is. Like I used to, when you watch videos of me competing and stuff, I played spider guard and De La Hilo guard, and now my game is much more. It's almost all like half and butterfly, and those are probably my main positions. But it's interesting because what happened was when I became a black belt. First of all, I didn't really. It was interesting when I turned 23. The way that I was able to compete when I was younger is there was this program called X-Fair, Air Trend, which I don't think exists anymore. I had a program called X-Fair. And it's basically like if you were 18 to 22, it's like a discount program for college students flying home. And so if you're 18 to 22, you could show up at a gate and say, I want to do standby to go to Atlanta. And they could say, okay, we'll put you on standby. If you don't get on this one, you'll wait for the next one. And it was like $69 for short trips, so like up and down the East Coast, and then to West Coast it was like $89, and so it cost nothing. And so, when I could decide a tournament on Thursday and fly out on Friday, it calls me, hey, can I sleep on your couch? When I turned 23, that was right before I got my black belt. That was a year before I got my black belt. That was hard, right? And I competed a lot less. And I had to continue competing a lot less because, I was in grad school. My workload was a lot, and I couldn't really even afford to go anywhere. So it changed a lot. So that was a problem. But then it's been interesting. One thing that I learned was that my game wasn't nearly as good as I thought it was because I required a certain level of fitness to be able to play my game.
Yeah.
This real like double sleeve, foot on the bicep, standing, passing Toriano game that I used to have, man, that requires a certain level of fitness to be able to do on someone at your level. So one thing that my game I had to learn how to do was slow things down, use less energy, hold on to positions, know when to like move forward incrementally and not give stuff back. So my game has gotten so much tighter, slower. It's like I remember feeling rolling like with Fabio Gurgel back in the day, and it was just like he'd move to a position and then you couldn't, once he got somewhere, you couldn't get him back. And that's kind of how I like to feel like my game is now. You know what I mean? I don't lose positions like I used to. So, but now I'm aware of that. I've been able to take this game to a point where I don't have to be in that great of shape to roll well. But when you go and compete, you still need that conditioning. So I actually, when I know I'm going to compete, I almost have to change my game a little bit just to be able to get the level of conditioning I need. Do you know what I'm saying?
What do you do for conditioning? Like, is there something that you like to do if you're, with the limited time you have?
Well, one thing, man, it's different. I tried a couple different things. I did a competition run like about a year and a half ago, and I tried a couple things. I think I don't think that they were very helpful, and the reason is because I think that there's this, for me, there's this kind of like, in most sports or exercise physiology literature, long, slow distance is bad for most sports, that hasn't have any carryover at all. And so you do, everything is sprints, everything is short. But then there was a paper looking at physiologic, or it was doing time analysis of jiu-jitsu matches, and it was looking at what energy systems were being used. Mm-hmm. And it's overwhelmingly oxidative respiration, right? So it's very aerobic because the periods where you don't move are very, very short. And you basically have this pretty moderate high output that's beyond anybody's ability to, use like glycolysis or creatine phosphate. So you really do need to have a very strong aerobic base. But how you develop that aerobic base, right? Do you do it in rolling? But then if you're doing it in rolling, if you're doing it at a certain intensity with a certain amount of volume, you're obviously increasing your risk of getting injured.
Sure.
So when you get older, maybe you can do that as a young person. When you get older, so I don't know. My feeling is that I would be much better off. For instance, I love running, but I only used to run like 20 minutes, and I'd run pretty hard. But now I'm starting to find out that if I try to run 30 minutes, even though I'm running slower, it's a totally different feeling. Mm-hmm. And it's, you think you're in shape until you try to do something else, So I like to run. It depends on if my body feels really beat up. I know I'd be like, man, maybe I shouldn't roll today, or
okay.
You know what I mean?
Yeah, I think for me, the cardio aspect is huge. Especially, I did a tournament that was submission only, and I had 3 solid submissions. I didn't hit any of them, and I kind of gassed out. And then once that happened, man, it was over for me. So
those tournaments are really interesting though, because there can be those tournaments are so different, because those guys that are really good at those sets of rules, they don't really have the mindset to even spend energy defending positions.
Yeah.
So they try to throw something up, it doesn't work, they kind of relax. They throw something up, it doesn't work, they kind of relax.
Yeah.
And those guys, and if you see those guys fighting a guy that cares about positions, it takes energy just to maintain your legs in a way to keep your guard. Yeah. You're just in there burning your energy down, And so it's a totally different situation in that. And I will say that I don't think that is any more realistic than points, because there's arguments to be made either way. Because the most important thing is the submission, true, but also if we're talking pure, you're talking about real fight, right? Yeah. You can't just lie there and you can't just walk over, sit down, and wait for somebody to give you a leg entanglement, right? Yeah. That's isn't realistic either. So I think they're just different. And I had one of those matches about a year and a half ago, and it was weird. I passed guard 4 times, mounted, but the guy didn't care about, or he didn't want to give up anything. And so I would get to his side, and he just kind of it's hard to attack that position, you know what I mean? Sure. And then the second you start to attack, boop, they get their guard back, and you're and there's no impetus on him to start getting better positions, because there's no points.
Right.
So it's just a weird game.
Yeah,
look how Gary Tonin won't place in ADCC, and then, he taps everybody at EBI.
Yeah. It's crazy. I think that was the first tournament like that I did, and my strategy, I was I'm going out there to finish, but what I should have done is kind of played it slow, and I actually burned my gas tank out so fast, and I actually was really tight. But sometimes people are fresh; they can kind of fight off some things, and I don't know. I think my strategy was messed up. I had some good submissions. I went to my go-to stuff, and I couldn't hit it. So, and afterwards, man, once you're fatigued and in your head, there's no clock that's going to run out. It makes it hard. You're shit. There's no time. The time limit's not going to save me. It's I got to somehow recoup this energy, and sometimes it's not
it's
there.
It's so hard to train yourself to just allow people to just do whatever, you're not thinking about defending any positions.
Yeah.
It's hard, because that's really the only way you can rest.
Right.
It was really interesting watching Felipe Pena and Gordon Ryan, and not the one at ADCC, but the one before that, because of how that was.
Where did they go? Where was the competition at? I remember Pena beat them.
It was just in an academy, closed doors.
Really?
And it was really interesting. He did the exact same at the end. Penna did the exact same escape from honey hole to the back take that he did in ADCC. The exact same one.
Uh-huh.
And he did it was good. Like he was, you could see that he was being more aggressive in positions, but at the same time he was smart in that he would get there and rest. You know what I mean? Like he would get to a good position and rest, and he wasn't worried about somebody calling him for stalling, and then he would try to make Gordon a little bit uncomfortable. I don't think it worked, but man, someone like that. I mean, Felipe Penna's got more endurance than probably about anybody right now that's competing.
I almost feel like you don't like most people like that kind of know jiu-jitsu. A lot of them know Gordon Ryan, but not a lot of them know Felipe Pena. He's like, dude, I think I feel like, I mean, to me, he's not underrated. He's phenomenal. He's incredible, but like, I think he's almost like underrated a little bit.
Well, he's only underrated if you don't train with the gi a lot.
Yeah.
So if you're a gi person, everybody knows, you know, there's a different set of people that are like kind of, it's weird because now it's really shifted a lot.
Yeah, it's a split.
You know, it's split so much in the last like 2 or 3 years, especially. Like there's these gi people that are like, these people are the top, and then there's no gi people, you know what I mean? And that's why, you know, I mean, I think that because like when you say that to me, I'm like, I can tell you like which tournaments he's won off the top of my head, you know. But like a lot of guys that just do no gi, you know, they don't pay attention to that stuff.
Yeah, I think you're right. There has been such a split, and like, you know, some people just now they're like, I only do no-gi. Or, you know, I prefer the gi, but I feel like doing no-gi complements my gi game so much. And I want to do both. I enjoy the gi better because I feel like I have a lot better I have a lot of collar chokes and things that I like to use. But, man, no-gi is, like I said, it's different. There's more movement, more scrambles.
I agree with Danaher on this one in that I think he said something similar, and I've always thought this too, is that they're both really important to train because they both teach you different things. So, for instance, I like to train with the gi because there's a big difference when somebody's 280 pounds lying on your side with their hot, wet gi draped over your face than when and they're and all that friction, and they don't feel like you don't feel like you can move them, and then no gi where if they make a little bit of movement, whoo, you know what I mean? So no gi, it's much easier. You get a false sense of security that you can get out of stuff. It's a lot harder to submit. It's a lot harder to submit in no-gi, right? Mm-hmm. It's just harder to get an arm bar, right? Everything's so slippery. Yeah. So I think to get good at no-gi will help you get good at submissions. But I think that training with the gi helps make you calmer. It gives you a tighter defense. You know what I mean, to bad positions. So I think that they're both awesome, you know. I haven't gotten to train no-gi though in forever. It's just how it's been. But
how often are you training now?
Right now, for the last like 9 months or so, I've been training I train like 3 days a week because unless I'm competing, I'm at a point now where I've been doing jiu-jitsu for so long that I don't need to go every day to learn a lot. Yeah. Saying you know what I'm saying? Like I'm not going in there like it's like my mind's being blown every day. You know, I go, and so for me, when I'm not competing, training 3 days a week is fun. I look forward to it. You know what I'm saying? Like, you know, one day I do my thing where I work out or I run, and the next day I'm like, hey, jiu-jitsu, you know, and I'm excited about it. When I start training multiple days in a row, it starts to feel like kind of start to feel like a job if I'm not preparing for something. Now, if I'm preparing for something, then I'll train. I like to train 5 days a week. Sometimes I'll train 6, just depending upon how I feel. But if I train 6, I'll usually train like I usually take a day off somewhere in the middle. You know what I mean? So like I'll find a place where I can train on Sunday. So I might train, you know, Monday, Tuesday, and then Thursday, Friday, Saturday, or something like that. You know what I mean? That's I'm not doing the math right now.
Yeah, it sounds like just basically when you're training, you're basically doing it to kind of sharpen, kind of for more sharpen your skills, keep your timing on point, kind of keep that muscle memory. That's for me. That's the thing that I mean, right now I train about 2 days a week. 3 is good. I'd love to do more. Obviously having family and stuff, it makes things hard. But I feel, if I train about 3 days a week, I stay nice and sharp. I have a day in between where I can rest. It keeps my muscle memory kind of, I'm not thinking as much on the mat.
And it's fun. You know what I mean? When you start doing something every single day and you feel like you have to be someplace every single day, I mean, like that can start to feel like a chore. You know what I mean? When you're not preparing for something. If you're preparing for something, then you need to put your effort into it. But this way I can keep in shape. I go in there and I play with things. I try things out. Sometimes I'll tell my trainer, hey, I'm going to go hard today. I'm going to go fast today. And I'll try that. And that way it's fun. Like I say, like for me, about 80% of the time that I'm training, I'm trying, but I'm not training like I'm going to compete. You know what I mean? I save that because I don't like to train like that all the time. Because that kind of training, like by the time you're getting ready to go to a tournament, you should be like, for me, I'm like sick of training. Like I'm like, ugh, you know what I mean? Like that was miserable. Like I'm just, you're so like amped up. You know what I mean? It's just, so that's not fun.
Yeah. Chris, are you good on time? Or are you about, how much time do you got?
I can go like 5 more minutes.
Okay, cool. Like there's some other stuff I want to get into. I kind of wanted to get, and we can do this maybe if you got some time down the road, another time to get a little bit of background, just as far as people, just as far as your background, where did you start kind of training, just briefly, where did you start training and where did you get your black belt and kind of what are, I know you were ranked as far as brown belt, ranked number 1 brown belt, I think for a bit, and you won the Nogi Worlds or...
I won the world championship, the Gi World Championship at brown belt.
Gotcha. So you were like ranked pretty high as a brown belt for a while, and then.
And I won the Abu Dhabi qualifiers for 2007 Abu Dhabi in the Pan Am as a brown belt too.
Any favorite victories, favorite accomplishments, favorite tournaments that you've won?
I mean, for me, the 2007 World Championship was the sweetest because, I mean. The 2006 Abu Dhabi trials was awesome because that one was really satisfying because I had basically worked that whole year. Like I competed that whole year. I think I competed like 15 times that year.
Wow.
And I was working towards that. And if I had done that tournament at the beginning of the year with the guys that were in it, I would have felt small. I wouldn't have believed that I could win, you know what I mean? But I went in that tournament and I just kind of felt like I did everything right. Like, I remember like a week before the tournament, I went on a run. Like there's this, like small mountain and it's like 1.25 miles to get to the top. And it's pretty intense to run. I used to do it on Sundays. I remember I ran it. And like the week before tournament, and this lady comes up, and I'm sitting at the top, and my hands are behind my head, I'm standing on a rock. And this lady comes up, she taps me on the shoulder, she's like, hey, I took this, do you want this? And she took a picture of me standing up like that. And it was like, it was just so cool because it like, it like captured, like, it seemed like it captured like all the work that I'd put in. Mm-hmm. You know what I mean? And so when I won that tournament, it felt like, wow, like, you put your mind to something, and you work really hard, and you can accomplish it. So that was really cool. The 2007 World Championship was just really special because I had only been walking. It was in August. I'd only been walking for like 3 months. I hadn't. So like in January that year, I broke my ankle, and I was off. It was non-weight bearing for 6 weeks, and I was partial weight bearing for like another month. Wow. And then I had the Abu Dhabi, and I'd only been walking I'd only been full weight bearing for 2 weeks prior to Abu Dhabi. It was ridiculous.
That is absurd, man. That's
absurd. But you know what I mean? What am I going to do? Like not go? It was stupid. I mean, what are you going to do? And so, but that year, the World Championship was But at that time, it was the first year was in the U.S. and they did it in August instead of like June, I think it is now. They did it in August, so I was like, okay, I have time. And I don't really remember a lot of the preparation for it, but I do remember that they asked me if I wanted to do absolute, and I was like, no, I can't do any stand-up. You know what I'm saying? I'm not comfortable. I still had issues for years after this with being comfortable on that foot.
Right.
And so I was like, nah, I can't do that. And I won the World Championship, and I can tell you that it was, if I hadn't, the match order was great. Like, because I don't remember who the first guy I fought was, but it wasn't too much. You know what I'm saying? Like, it wasn't like where it was super ridiculously hard and it would have kind of broken my confidence, being like, man, I'm not ready for this, you know? And then every match got a little bit harder.
Nice.
But I submitted everyone. So I had 5 matches, 5 submissions.
Wow.
And, you know, to be able to, like, come off an injury like that and then, like, go to the World Championship and submit everyone, it was crazy. It was just crazy, you know what I mean? Like, that. So that was really special. But I said that in Abu Dhabi, you know.
Awesome. What about when did you and your injury was a jiu-jitsu related injury to your ankle? We can get into it maybe another time, but was it
yeah, no, it was a freak accident. Basically what happened was I was actually fighting Lovato, and it was like Rafael Lovato. So it was like we were in overtime. It was 0-0, and then we were in overtime. It was still 0-0. And he tried to do Koichigari tried to do, I don't know, so he tried to do like an inside foot sweep or an out, not an inside trip, but like he tried to basically sweep my left foot out to the side.
Gotcha. So almost like an inside trip kind of.
Not inside trip. He used his right foot on my left leg. So it's like his cross leg, right? This leg. Boom.
I got it. His right foot on your left. Got it.
Anyway, so the mats that we were on, it was weird. It was like if you took a tarp mat, but you took the top part of it off. So it's just like sticky foam. Yeah. It was weird. And I remember thinking when I got on the mats, I was like, man, what is this? It's like they took the top off. And when he did that, so my left leg moved out, but my right leg, so I'm kind of falling to my left side, but my right foot doesn't move. It gets like locked.
Got it.
And so my left leg is going out to the side, my right leg is locked, and my shoulder starts falling over my right shoulder, and my ankle just goes. And it was just a freak. And I remember there was only like 10 seconds left because I actually remember the sound. And so it was like almost no time left, and then boop, bam, my leg's broken. It's just crazy.
What was the injury? What did you fracture? Was it like tip fin?
It was my distal fibula and my medial malleolus.
Oh wow! So that's like the outer. It's the outer bone and then the inner.
The very bottom part of the tibia on the inside.
Okay.
It tells you that that ligament that on the inside of your ankle is super strong because that didn't go at all.
Were you talking about the deltoid ligaments?
Yeah.
I guess?
Yeah. So I ended up getting a plate on it.
Wow.
And then Abu Dhabi. So that was like what, January 17th, and Abu Dhabi was like at the beginning of May. You know.
Wow.
What are you gonna do?
For people that don't understand, that's incredible. Like, I mean, recovery-wise, to be weight-bearing, like the amount of probably bone density and just strength and proprioceptive feedback and just balance and all that stuff that you lose from that kind of injury and not using that, that leg properly for so long is just insane. Like, to being able to actually use that leg to win and submit and do. I mean, it's crazy.
That's what I was telling you. So I think because of that, right, I sprained my other ankle in my first match. That's when my ankle went boom.
Gotcha.
Because I went I yanked my leg out of a heel hook and I put my left leg on the ground and I had to spin around really quick to face him. And when I spun around, my leg just goes boom. But I had both of my ankles taped because I think everybody knew I was injured. But I wanted to I didn't want anybody to know which one if they didn't already know. So thankfully my ankle was taped up so it prevented some of the swelling.
Yeah, absolutely. Compression's huge. So, Chris, I'd love to have you back on sometime, man. We got into a lot of the medical stuff, which is interesting to me and hopefully some people listening. I want to kind of get into maybe another time about your coming up in jiu-jitsu, how you got started and your training regimen, injury prevention, things that you've done in the past that and how you've continued to train kind of as you've gotten older. I think that's a big thing for a lot of people. The thing I love about jiu-jitsu is the longevity of it. I do think in some capacity you can always train jiu-jitsu, and that's the unique thing. There's a lot of injuries and things that happen in jiu-jitsu, but it's so unique that there's so many ways to practice jiu-jitsu. Yeah. There's so many variables.
You have to allow your jiu-jitsu to evolve.
Yeah.
You get so stuck on what you're able to do at any one point. And that's why being playful and not training like you're competing all the time is really important,
Chris, if anybody has questions for you or any kind of studies you're doing, is there somewhere they can contact you or anywhere like you prefer people reach out to you if they have anything jiu-jitsu related?
Facebook is cool with me. I don't even know. Just look me up. I don't know what let me see here. It's just Chris Moriarty, but apparently there are a bunch of us on Facebook.
Oh, okay. Yeah, you're...
apparently there's a really big science fiction writer named Chris Moriarty.
Nice. Well, best of luck, man, in getting your residencies done.
Residence.
It's still kind of... So, hopefully, best of luck. If there's anything you need from me, please reach out. I'd love to, if there's any research I can help out with. I'm always interested in injury prevention. It's kind of a big thing that I do. Not a lot of medical practitioners really, understand jiu-jitsu and the kind of the injuries and the... thanks for your time, man. I'd love to have you on again sometime. Best of luck with everything.
Take care. Thanks a lot for having me.
All right. Thanks a lot, brother. Have a good one.
Yeah.
Thank you to my guest, Dr. Chris Moriarty, for joining me on the podcast. Thank you guys for listening. More podcasts available on the website, jiu-jitsutherapist.com, Stitcher, and iTunes. If you guys have any questions, please send them my way at jiu-jitsutherapist@gmail.com. And enjoy the videos on YouTube on injury prevention. If there's anything you guys want to see or have me talk about, make sure to send me a question. Thank you guys for tuning in, and we'll see you next time for another podcast.